Hi, Dr. Yass here. In this video, I want to try to provide to those of you suffering with chronic pain an almost declaration of independence from your pain. They are rules that, as far as I'm concerned, are critical for you to accept, for you to finally rid yourself of your pain. Many of the rules pertain to taking responsibility for yourself, to not allowing yourself to just accept what practitioners tell you. There are rules regarding how pain is created, how you resolve it. And basically, the intent of this video and this declaration is try to give you, the individual, a set of rules to utilize so that you could finally get to your end result of being pain-free and fully functional. And I feel that if you are willing to accept these rules and declare them as your means of independence from pain, you can finally get to that end result of being pain-free and fully functional. So what I'm really hoping is that I'm going to go through these rules, and if you're watching, please think about them. If you end up watching the video at some point, maybe after it, take your time, think about the rules, but ultimately, hopefully, you're going to see these rules, every one of them, as having value in your ability to finally achieve independence from your pain. And so what I'm hoping is you're going to really embrace these rules, and whether it's actually or symbolically declare that these are the rules that you will use to ultimately become independent from pain. So I'm going to go through them one at a time, and hopefully you'll either read along or at some other time you have the opportunity to read them on your own and digest them. So first, number one, I declare that the medical system has failed in its ability to identify the cause of pain and therefore cannot be trusted to diagnose and treat my pain. Number two, I declare that I will use the best of my effort to establish the cause of my pain only when I am satisfied will I accept a diagnosis from any practitioner. So we're now asking you to take the responsibility for yourself, that only when you are satisfied will you then accept the diagnosis from the practitioner. Number three, I declare I will not accept the diagnosis from any person unless they can explain it to me in regular language so the diagnosis makes sense to me. No more will you be willing to accept complex medical verbiage and think that that's acceptable. The practitioner must be able to speak in regular personese, or you will not be willing to accept what they're saying as fact. Number four, I declare I will not accept the finding of any diagnostic test like MRI or X-ray as the cause of my pain unless the symptoms that I present can be attributed to that finding and can be proven to me with evidence. So you will no longer accept MRI or X-ray findings unless the individual can describe how that identified tissue is creating your pain and actually provide you with the evidence and not simply say, accept it because I said it. Number five, I declare that the MRI is actually baseless in nature in identifying the cause of pain, and that interpretation of the pain is the only true method to understand what tissue is creating that very pain. So you are acknowledging that the MRI is actually theoretically, clinically, and scientifically been proven to be baseless in identifying the tissue creating your pain, and therefore you will only accept the interpretation of the symptoms or pain as the true method to identifying what tissue is in distress, creating that very pain. Number 6, I declare that if my symptoms are associated with activity and are decreased or end with rest, this indicates that the tissue in distress is muscle. This is an acknowledgement that activity is the result of muscle, and therefore, if I can associate my symptoms with activity, then that indicates that the tissue creating the pain is muscle. Number 7, I declare that the use of medications, including opioids, antidepressants, anticonvulsants, epidural nerve blocks, cortisone shots, in parentheses, including the lidocaine, which is in the shot, which is never revealed to you, etc., does nothing to resolve the distress of the tissue, eliciting my pain, and only masks my awareness of the pain, leading to indefinite suffering of pain. Let's be absolutely clear. Once you've reached the point that the medical establishment or practitioner is recommending some sort of medication or injection or something of this nature, they are putting up their white flag and saying, we no longer are confident in our ability to identify the cause of your pain and resolve the distress of that tissue. Therefore, we will only now try to do things to mask your symptoms. So by definition, that means that they are basically identifying they could never establish the cause and resolve the cause of your pain. This should make you very hesitant to continue treatment with those type of individuals. Number 8, I declare my understanding that muscular causes of pain do not show up on diagnostic tests, and therefore there is no medical specialty educated or trained to identify them, making them basically undetectable to the medical establishment. This is a recognition that you, for most of you, going back to one of the prior declarations, have recognized that your pain is associated with activity and diminishes when resting from activity, therefore indicating it is muscular, and recognizing that these types of muscular causes will not be identified by the medical establishment simply for the fact that they are not educated or trained to identify them. Number 9, I declare that if my pain is not constant, and I was diagnosed with a structural abnormality like a herniated disc, stenosis, arthritis, or a meniscal tear, this simply makes no sense, and the diagnosis must be ignored. Pain that is intermittent and varies in intensity when associated with performing activity or stopping that activity is most likely muscular in nature. To me, this is the most obvious. You don't need a medical background or education or training to recognize that if someone says arthritis is the cause of your pain, well, arthritis is a continual process. It never stops. It's continuous once it starts. So if the process itself is the cause of your pain, how could you say that the pain you're experiencing is from arthritis if the pain is not constant and doesn't vary much in intensity? The same could be said for every one of these structural variations. This has to be a red flag. The purpose of these declarations are to provide you the understanding you need so that you can take control of your situation. And if you do declare your allegiance and understanding of these processes, then this is what's going to help you take control of your situation so you can finally, again, become independent from your pain. Number 10, I declare that if I come to the recognition that the cause of my pain is muscular, that the only way to resolve the cause is to perform progressive resistance strength training to increase the force output of the weaker muscles until it is greater than the force requirements of my activities, allowing me to function pain-free and fully functional. This is the point to recognize that if you happen to be told through some miracle that the cause of your pain is muscular, or that someone is trying to do something quote unquote muscular to address your pain, that ultrasound, electric stimulation, red light, any of these other things, if in fact the cause of your pain is a lack of strength of muscle in relationship to the force requirement of your activity, will simply not work. The only thing that will resolve a muscular cause of pain is strengthening the muscle through progressive resistance strength training until its force output is greater than the force requirement of your activities, thereby ending its need to strain and elicit pain to create awareness that it is in fact not strong enough to do the activity without symptom. Number 11, I declare my understanding that most medical practitioners, although having the best intentions, do not recognize the limitation of their educational and training backgrounds, leaving them unable to see why their diagnoses and treatments fail. This simply relates to the fact that you continue to go to these people and they continue to do the same thing and nobody gets better. And that's the simple recognition of the fact that at this point, 130 million Americans and 1 billion people worldwide are suffering. There's overwhelming evidence to the number of people who have committed suicide based on not being able to deal with their pain, the number of people who are suffering with depression, hopelessness, who have lost jobs and who have lost family connections because of their pain. And the reality is that these people continue to do the very same thing, which has to make you believe that they are just not educated or trained to understand that what they're doing isn't working. And that's why they continue to do it. It is not an indication of some sort of malice or anything of this nature. It's just a recognition of the fact you can't keep doing the same thing and expect to get a different resultant. So that to me seems like a pretty clear declaration. Number 12, I declare that if I am being treated for a period of months with no improvement in my pain, I must see the treatment as not effective and must seek an alternative treatment. This should be obvious to you. If someone tells you they are addressing the tissue in distress, I mean, if it's supposedly going to be resolved by surgery, literally at the completion of that surgery, you should be out of pain. I don't know how anyone doesn't see that. And so if you're continuing to have pain for months and years on end, doesn't that kind of indicate that the tissue in distress is not the tissue being treated? And that maybe it's your responsibility, not the practitioner's responsibility, to come to this recognition and acknowledge you probably need alternative treatment? These are declarations of independence from pain for you, not for the practitioner. Number 13, I declare my understanding that my pain being diminished but returning consistently indicates that the treatment being performed is not addressing the cause of my pain, and I must seek an alternative treatment. So this goes to the same premise, not just the time frame, but if you keep having a treatment and the pain goes down a little bit, and then somehow it just comes right back, and then you keep going back, and they keep doing the same treatment, and it keeps coming back. This intermittent reduction in symptom clearly indicates that all the treatments are not addressing the tissue in distress, the tissue eliciting the symptom. There's some secondary mechanism that's reducing your symptom, but it's not addressing the tissue in distress. Realize that the connection we're looking at is a tissue in distress eliciting symptoms such as pain to let you know that it is in distress. You perform an intervention to resolve the distress of that tissue, thereby ending its need to elicit the symptom such as pain. So if you've done that correctly, the pain doesn't come back. That's the idea. So if it's just diminishing but keeps coming back, at some point you, the individual, must declare to themselves that clearly the tissue in distress is not being worked on, and therefore you need an alternative treatment. Number 14, I declare my understanding that if the cause of pain is muscular, only I can resolve the cause by performing the correct exercises correctly, and no treatment by any person can address the muscular cause. This is the most clear type of declaration you need to accept, that if in fact the cause of your pain is muscular, only you can make yourself stronger. Even I can't make you stronger. Even if you took the Yass method, at best I can educate you to understand what tissue is in distress. If it's muscle, which particular muscle, how to strengthen the muscle appropriately, how to use progressive resistance, but ultimately only you're going to be able to resolve that symptom, that pain, through doing the appropriate exercise. At some point, if it is in fact muscular, you're going to have to declare to yourself, and this is hard, that only I can resolve my symptoms. So I need to understand how to do the exercises correctly, which exercises, and how to progress resistance to resolve the muscular deficit leading to my pain and dysfunction. Number 15, I declare that I will only work with people who see me as a whole and try to understand my pain in my body as a whole and as it relates to my physical, emotional, and spiritual state. This is the only way I can be returned to living the life I am entitled to and justly deserve. The point here is that if you have pain in your knee, stop going to people who take their eye and put it right next to your knee and assume that the cause is at the knee. I have shown that in more than 99% of cases, understand what I'm saying, in more than 99% of cases, the cause of pain is not where you are experiencing that pain. And until you can go to somebody who recognizes this and sees you as a whole, your whole body, and tries to do a full body evaluation and takes a history to understand whether there are other mitigating circumstances at other tissue, at other joints that may have created the pain at the joint you're experiencing now, then you're never going to come to the conclusion as to what tissue is creating your pain. This goes along with the idea that you are a physical, emotional, and spiritual person, and over time, as chronic pain is sustained, you may be having emotional and spiritual issues that are related to the fact that you have not been able to have that pain resolved, and those have to be addressed. Those have to be addressed, or else you're never wholeheartedly going to aggressively look to take responsibility for yourself and end that pain, physical pain. So I want you to recognize that at least one person recognizes you as a whole person and recognizes that there is this connection between physical, emotional, and spiritual, and that all need to be addressed to make you be whole and to live the life you so justly deserve. So there you have my 15 points that make up my declaration of independence from pain that I am imparting on you. And I hope that you see the value in this, and it hopes to guide you. And again, whether it is actual, you print this and sign it, or symbolically in your mind, you say, yes, this makes sense to me. I am going to follow this process to the end until I can be pain-free and fully functional, then that is what I am offering you here. So if this video makes sense to you and is helpful, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe and click the bell icon to get notifications when new videos are added or when I'm live on YouTube. If you'd like to contact me, you can do so by email at drmitch@mitchellyass.com. If this stuff makes sense and you've come to the realization that the Yass method is in fact the path you'd like to take to resolving your pain and becoming whole again, you can do so by going to my website, livewithoutpainsplural.com. Click on the Schedule Now button. You'll have the opportunity to schedule an appointment, either in person in Jacksonville, Florida, or by Zoom anywhere in the world. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.